Hello, my name is Jarrafula Mesa. I'm going to do a daily routine anesthesia check-out procedure in our workstation. Anesthesia workstation is just like, or anesthesia profession is just related to or accompanied with the work of pilot. The pilot should check any technical problem before flight takes off. And in between, during flight, there is minimal work is required. Just this is true for anesthesia procedure. So, in anesthesia workstation, we have two workstation or components. The first one is electrical component, and the second one is pneumatic component. We are going to check the electrical component of the anesthesia workstation. Here, our socket is functioning. Electrical socket is functioning. Here is functional. This is from outlet. So we can also check. This point indicates that there is electrical coming from wallet, and the machine is already charged. We need to have adequate battery backup for both monitoring and for both anesthesia machine. We need to have electrical battery backup. We need to have electrical battery backup. You can also check anesthesia is functional or charged or not. This indicates that if there is a charge, so you can close it. So electrical circuit should be checked, is appropriately plugged, is switched on, and adequate battery backup is mandatory. Every day, mandatory. Now I'm going to check the pneumatic component of electrical machine. The pneumatic component can be classified into three components. The first one is high pressure system, second one is intermediate pressure system, and the third one is low pressure system, or low pressure system. Now, in high pressure system, the cylinder is a prominent one. So we need to check the cylinder is with the oxygen content as well as the type, color. Mostly cylinders are color coded, labeled, and tagged. The color coded, labeled, and tagged. This is for oxygen cylinder. We know this because of label. The color is not universal still now, so color is not always the indicator of oxygen content. So this is blue, even though it indicates that as universal color code indicates that the content is nitrogenous oxygen, but due to the level on this level, we know this is oxygen cylinder. In this cylinder, we need to know the oxygen content. I have already around one bar on around the 50 bar, and from this we can also calculate duration of cylinder. For long procedure, this is not adequate still. This is not adequate. We can know the duration of cylinder, and we can associate with the surgery time. If the surgery is long surgery time, if the surgery is short procedure, we can change our cylinder. We need to know the cylinder content by this. And this is the pressure regulator. This regulates the pressure that high pressure that coming from high pressure system to convert intermediate pressure system. This is around 5 bar. This is the pressure regulator. This pressure should be, this oxygen pipeline should be properly plugged in into the anesthesia machine. This is properly plugged in. Should be the appropriate hole and the appropriate oxygen content with appropriate cylinder. Here, now I'm going to check. I'm going to see if it's present, best. But for now, we don't have E-cylinder cylinder on this machine. This is indicates this is the position of E-cylinders. This indicates they have their own pin index system. They have their own pin index system. If there is technical error, abnormal connection of abnormal cylinder with abnormal hole, this pin index system, their pin index system, this will prevent the disaster that occur during anesthesia procedure. Okay, here we have pressure gauge. Pressure gauge is here. This indicates that the pressure that coming from our pipeline pressure gauge and cylinder pressure gauge. Pressure cylinder gauge. Here, this pressure should be between 50 and 60. Should be this pressure should be or around 4 bar. For this machine, it's not appropriately corrected. We need to adjust this pressure man. We need to adjust this pressure because this pressure is greater than 4 bar or greater than if it is not between 50 and 60. If it is with PSI, should be between 50 and 60. If not with PSI, we need to have 4 bar and we need to adjust the pressure regulator. We need to adjust that. This indicates that the pressure, the cylinder on the anesthesia machine. So now we don't have each cylinder attached on this machine. This indicates that this is 0. This indicates this 0. Now I'm going to check the leak for mechanical ventilator. To check the leak for mechanical ventilator, I have to occlude Y-piece. And I have to change this mechanical ventilator to this. And with oxygen, flash, I have to push this. I have to the bellow should be filled, and this pressure should be less than 150 or less than 50 milliliter, less than 50 centimeter of water, and the bellow form should be less than 100 milliliter per minute. This indicates that there is no pressure leak, there is no mechanical ventilator leak. There is no mechanical ventilator leak. I have already checked. There is no leak on this ventilator. Okay. Now I'm going to check the low pressure system leak. Low pressure system leak. Low pressure system we can check in 2 ways. The first one is manual, and the second one is if there is suction bulb, we can check with suction bulb. And when we check with suction bulb, the machine is in off position. But if we check with manual, the machine should be open. Now I'm going to open the machine to check the pressure, the low pressure system leak. Now the machine should be open. Now to check the low pressure system, we need to check whether there is any crack on these flow meters or their arrangement. Even their arrangement is also there side effect. Oxygen should be the last gas. Oxygen should be the last gas. Arrangement. We need to see the arrangement if there is any correct. And there is anti-hypoxic gas. Anti-hypoxic should be checked. If we open only nitrogen, oxygen should be open. If we close the oxygen cylinder only, the nitrous oxide should be, the nitrous oxide control knob should be closed. This anti-hypoxic device, this is one indication of our anesthesia machine check to check any leak. To check any leak from the kilometers, have to convert this to the water common gas outlet. Have to change it. Then I open oxygen to some test level. When I'm check this machine with manual one. So when I press this should be fall down, fall down, fall down, fall down. If there is a leak, just stuck out here. There is no movement of this leak. There is no movement of this. We can also check for the mechanical. The vaporizer is still now here. I can also check mechanical. There is minimum movement of the bobbin. Minimum movement of the bobbin. This indicates that there is no leak in this vaporizer. I have did the low pressure system leak now. We not also observe the bobbin movement itself. Bobbin movement should be with normal pressure. With bobbin adjustment should be checked. Bobbin movement also should be checked. And in case of vaporizer check test, we need to observe the proper arrangements. We need to check the proper arrangements. The position should be at the position. If there is deviation from the normal position, the appropriate output will be established. So the upright position is mandatory, and appropriately filled. If I have full isoflurane, since there is no sevoflurane in this country, for now I don't have sevoflurane, but for isoflurane I have full of isoflurane. And their knobs should be fully rotated. Their bobbin should be fully rotated, and the interlocking system should be functional. Unless if there is damage of interlocking system, inadvertently we can give two inhalation agent at the same time for a given patient. So interlocking system should be checked. Interlocking system for a vaporizer, we can't open the other vaporizer at a time. Let's check it. I opened isoflurane. I'm trying to open the sevoflurane vaporizer. I can't because there is interlocking system. This indicates that the pressure system the vaporizer system is such anti-disaster event. Now I'm going to check the oxygen pressure failure alarm. Oxygen pressure. This pressure driven alarm. This is recommended for all. It is first to be recommended. We need to have alert to do something. Now to do oxygen alarm check out, I have opened oxygen. Oxygen kilometer 4 now. Now I am going to close the cylinder pressure. I am going to close the oxygen cylinder. Now I already closed the oxygen cylinder. I have to hear some alarm now. Just wait for a moment. Wait for a moment. Here, the alarm is starting to shout. This indicates that there is alarm on this anesthesia machine. Best to prevent disaster. The catastrophic event that occurs when we do anesthesia. Here, the bobbins are falling down. This indicates that the pressure, the oxygen pressure alarm is functional. When I open this oxygen cylinder, this alarm should be absent. Now I'm going to open slowly. Slowly I am going to open this pressure. Okay. Now the oxygen pressure alarm is absent. The oxygen pressure alarm is absent. Here I am going to check the ventilation system, manual ventilation system, mechanical ventilation system. To check the ventilation system, I have to adjust the ventilation parameters first. The ventilation parameters are tidal volume, inspiratory rate, inspiratory-expiratory ratio, and the PEEP or positive index expiratory pressure should be adjusted first. So I have here these oxygen parameters are already I checked it. Oxygen parameter based on the patient I have. The first patient I have. So after I did this, now I'm going to check the lung test. To check the lung test, I have to convert this oxygen vent bag selector switch to the vent mode. Then with oxygen flash, I'm going to feed the bellows. Now this should be the lung. The machine should be functional. The ventilation parameters I adjusted here is around 500 tidal volume. Respiratory rate is here, and the ventilation data output should be nearly to the what we have adjusted. So here around 337 tidal volume is given for the patient. This indicates that our machine is mechanically safe. In this ventilation lung test, we need to observe assume that this is the lung of patient. Then there is compliant of bag as a lung of patient. And in this ventilation system, we need to also observe the configuration of the system. There is expiratory limb, this is inspiratory limb. This is one unidirectional valves. During this unidirectional inspiratory valves rise up when the patient takes in oxygen. When the patient breathes in, this rise up, and when the patient is expired, this will depress down. This indicates that the configuration of the electrical system. There is also disconnection alarm. If the ventilator system is suddenly disconnected, the alarm should be present. Here we are going to test the disconnection alarm. Here this indicates that there is disconnection alarm. In case of one lung test, we did this, and we can also check the two lung system by we can take this as a lung of patient. This is two lung test. We can take this as a lung of patient. This is a manual bag I'm going to apply. I have just around 30 centimeter of water, APL. Then I'm going to do mechanical ventilation. Manual ventilation here as complained as a lung of patient. Two lung test. Just complaint for this. We can also check leak test for the bug ventilation system. We can also take the bug ventilation system. I'm going to close the APN lever. Then I open YPs and I open this pressure up to oxygen up to 5. Then by flash here there is no leak. This is ventilation system check, just like this. Sometimes we also use the auxiliary oxygen flow method for support or for oxygen supplement for the patient, and as well as during jet ventilation we also use the oxygen flow method, nasal flow method or auxiliary oxygen flow method. Some machines have their own auxiliary flow methods, but in this machine we use common gas outlet and common gas outlet as auxiliary oxygen flow method. Now I'm converted to this common gas outlet. This indicates that this auxiliary oxygen flow method. This indicates that there is. We can also use this. We use this as auxiliary flow method. After we did all anesthesia machine check, there is what we call the final position. Until the first patient arrives at OR, the final position of the anesthesia machine should be oxygen flow meter should be off position, vaporizer should be off position. Here there is off position. The mechanical bug vent selector should be to the bug vent, the bug vent mode. The APL should be fully open and just like this. This is the final position of the anesthesia machine. Check out procedure at the end of anesthesia machine. Check out procedure. When our patient is pediatric, especially for patient less than 25 kg, for pediatric patient, we have different breathing system. This is what we call semi-open Mapperson system. In Ethiopia, we use Mapperson E and Mapperson A for this country. In this Mapperson system, we have this is Mapperson D system. This is Mapperson D system. The fresh gas flow is at the end of near to the patient, and the vaporizer gas is at the end of this patient. And we have different breathing system for pediatrics. For this breathing system, we convert this to the nasal gas. This is common gas outlet that attached to the nasal gas outlet. Then this is the intubation. This is the scavenging system. We apply here with controlled ventilation. We use in such condition. In anesthesia machine, we also have rebreathing preventer. We have rebreathing preventer in anesthesia. In anesthesia, we have rebreathing preventer. Rebreathing is just there is means of carbon dioxide removal in anesthesia machine. This is what we call canister. The canister has soda line, just that used to remove carbon dioxide from
carbon dioxide. This soda line should be the original color should be attached with this plaster. The original color should be this. For example, the original color is white, but since we changed it today, this is original color is white. And if we are using this canister, we can also check is functional or not by touching this. If it is functional, there is somewhat heat. There is heat generation. If there is exhausted, 75% of it is greater than 75 exhausted, since it become acidotic and the pH is less than 10, the color would change. So by observing the color, heat generated, the color, heat, as well as the color heat depth also can tell us is the soda line is exhausted or not. At that moment, we have also the scavenging system. Since the expiratory component of our patient has some inhalation anesthetic agent, including oxygen, we need to remove out from the OR. This is the dangerous for OR rating or operation theater team. This is dangerous, should be removed out from the OR. So we have scavenging system here that is attached to here. This is attached to here. We need to remove out from the operation theater. This is attached to the outlet, the wall outlet. So we are safe now. This just like the anesthesia machine check. Also, we have monitoring. Now I'm going to check monitoring is functional or not. We are going to check the monitoring is functional or not. To check monitoring is functional or not, I have to open it. This is what we call integrated monitoring. Integrated monitoring, there is BP, there is capnography. Here I have capnography. I have capnography here. I have capnograph here. I have pulse oximetry, ECG, pulse oximetry, respiratory and cardiovascular system monitoring, especially as much as possible. Temperature regulatory monitoring also have to be attached. Pulse oximetry here. Pulse oximetry. I have pulse oximetry here. Pulse oximetry. So, to check the non-invasive blood pressure, the cardiovascular monitors, I have to apply on my hand.
Okay. Non-invasive PP or blood pressure is now counting. Sometimes we move here and there, move here and there. For that matter, maybe false high reading or false high reading linear. So sometimes this cup should be not too tight, too small. If it is too tight, has false high reading. If it is too small for adult patient, it is also high reading. And somewhat there is confusion. Is the patient is hypertensive or not? So we need to avoid such occasion. We need to have appropriate curve.
Pulse oximetry I can also check on my hand. I can also check on my hand. Pulse oximetry is just, oh, I am tachycardic, not. Okay, this pulse oximetry is just, I'm just around 91 oxygen saturation. Some anesthesia medicine also have their own, temperature regulators as much as possible. If we have thermometer, we can also regulate our temperature. Since in our country we expect that temperature is almost normal, we avoid. I think so. Or for the sake of resource scarcity, for such thing, this could be happen. Now we already have safe on anesthesia machine side. We are safe on anesthesia machine side. We need to close this monitoring now. We are safe on anesthesia machine side. Now we are safe on anesthesia machine side because all things are okay. Now we have to have airway rescue device. Airway rescue device, we need to have this ambu bag or self-inflating bag. Ambu bag. We have to have self-inflating bag or ambu bag. Here is the functional. Is a functional. We can also connect to here this outlet gap connect again length again. If there is any problem, any physical problem, we can use it. This is airway rescue device. The second one is different type endotracheal tubes as much as possible. If our patient is adult, 7, 6.5, 6, still the patient the second one is the second airway rescue device. This is LMA, laryngeal mask airway. Laryngeal mask airway. We have different size laryngeal mask airway. This is best if there is difficult intubation, difficult ventilation scenario. Difficult intubation, difficult ventilation. We have also BOGE stylet. This is stylet as much as possible. Different sizes stylet, and also BOGE. We need to have BOGE. We need to also have emergency drug, just like adrenaline, noradrenaline, sacs, atropine. We need to have these airway rescue devices and anesthetic emergency drugs. We also said that this is induction agent, thiopental, propofol as patient requirement. As patient requirement, we have such. We also have different laryngoscopy with different size. This is Macintosh laryngoscopy. This is functional because there is a light. As much as possible, we have to have different laryngoscope size and fluid, IV line fluid. Plaster for secure endotracheal to the position, and laryngoscope for stethoscope also. We also require a stethoscope. This is what we have to have when we are in part as monego anesthesia work. After we have all equipment is okay, now we have got normal functioning suction machine. This suction machine is functional. Suction tip is functional. we are safe on this side. Now we need to apply the pelvis can move down, up, and as the you can as sternum of our, as sternum as much as possible. The best position for intubation, binnarat or we can also move and tilt, okay, tilt forward, backward. We can do this. This is what I have about anesthesia machine. Daily routine anesthesia machine check out procedure. Thank you for everything.